Hi, everyone, and good evening. It's a pleasure to have the opportunity to talk to you, and thank you so much for coming to this presentation. It's a format that we use to get health information out to the community. And so we definitely encourage, I think Sue may mention this, but encourage questions, and we leave plenty of time at the end for questions. So I'll try to make it as stimulating as possible, and then we'll leave plenty of time for questions so that it is as valuable as possible to everyone. So lung cancer, and first I'll say I have no conflicts of interest to disclose. My work is supported through Baystate and through the NIH. So I'm going to talk about the epidemiology of lung cancer and what causes it and what are risk factors, and then lastly uh, what we can do about it. And first, to say that lung cancer is one of the leading cause of deaths, both worldwide and in the US. In the world, it causes approximately 2 million deaths a year, making it the sixth leading cause of death. And it causes approximately in the US 300,000 deaths per year. Um, and it's other things like heart disease and stroke are higher, but it's the leading cause of cancer related death. So, in terms of who gets uh, which cancers are the most common, breast and prostate are the most common. But in terms of which ones are the most deadly, lung cancer is by far the most deadly cancer. And it's almost, if you add up the next two, three, and four, you kind of get the sum up to the number of deaths from lung cancer. So, definitely a very important cause and something that we want to prevent from happening. No coincidence that lung cancer rates started picking up after smoking became prevalent, with about a lag period of 20 to 30 years. But you can see this increase, and this is the curve for males, but in terms of death rates from all the other kinds of cancers, it's much lower. And then when smoking, people stopped smoking, the rate started coming down. It's still much higher than all the other cancers, but thankfully it is on the downtrend. The For women, the same pattern happened. I will say that for women because breast for a while was the most common, and then advances in mammography and breast treatment for breast cancer made it the mortality improve, uh, and so now lung cancer is the most deadly for women as well. And so now talking a little bit about what causes it, the first and what I'm sure most people know is that cigarette smoke is tied to lung cancer. And in particular, cigarette smoke is tied or associated with approximately 80 to 90% of all lung cancers. The reason why the number is so high too is because a lot of people who smoke, it's not just one thing. It's, if they smoke, they may also be working in environments that put them at risk, such with asbestos or other things we'll talk about, or there's air pollution. There's usually multiple hits, but you know, many people have at some point smoked. And the lifetime risk of people who smoke, it can be up to 30% of people who smoke may get lung cancer compared to less than 1% in people who don't. So your risk is much, much greater if you are smoking. And it depends on the number of cigarettes and how long you've been smoking for. It also depends on the content of the cigarette. So if it's the tar content and the nicotine, and also whether it's unfiltered. And lung cancer starts off very small. And so that's why most lung cancers at early stages, people are asymptomatic. In other words, they don't really feel anything like a cough or shortness of breath. It's not until the later stages that you may actually start having symptoms from it. So it's important to think about potential risks and how can we catch it in early stages, because a lot of the mortality is tied into the fact that it's caught at later stages. And I will say a plug for smoking cessation. So if you stop smoking, there's many, many benefits, including um, improved mood, it improves your cough, your risk of heart attack and stroke pretty much goes down immediately. but the risk of lung cancer starts going down at about 5 years, and it keeps going down. And people who quit smoking get back an additional 6 to 10 years of their life just by quitting smoking. So one cigarette can give you back approximately 20 minutes of life. And I do want to bring up secondhand smoke. Exposure to secondhand smoke has been associated with lung cancer. And it's not as strong as directly smoking the cigarette, but as you can imagine, secondhand smoke often occurs earlier in life. So people get exposed as children, and that exposure occurs over a longer period of time. There's still a dose dependent, meaning the more you're exposed to, the higher your risk of lung cancer is. Um, but it's not, and it's not as harmful as directly smoking, but there is some risk there. And the other types of tobacco related smoking, so cigar and pipe smoking, both are, I think people often think, oh, I'm smoking a cigar. That's not been associated with lung cancer, or, smoking a pipe. But the truth is that there's also chemicals that when you combust the tobacco leaves or what's being put in the pipe, that can cause damage to your lungs and make it more likely that you develop lung cancer. And the data for marijuana is a little bit less conclusive. I think there's some studies out there that show that heavy marijuana use, so daily, several times a day, is associated with a slight increase in lung cancer. So there's definitely some concern for people who are smoking heavier marijuana. For people who are smoking occasionally, there does not seem to be a relationship between marijuana use and lung cancer. Uh, and the risks from secondhand marijuana smoke, I know a lot of people sometimes are exposed to from their living spaces or their neighbors or family and friends. That hasn't been well established, but the idea is that secondhand smoke should not be harmful. It should be less than if you are smoking marijuana occasionally. E-cigarettes are newer in the last 10-20 years. They come in all shapes and sizes. And they're definitely being marketed towards youth. Um, Things like social media or advertising close to schools, or things that content that school age children are consuming, and making it more attractive. It's electric. They put like neon. They give it cool names like Jubilee, and then they give it colors like neon. So those things are definitely concerning. The full effect of e-cigarettes is not known, mostly because they haven't been around long enough to really have good evidence to say whether they can cause lung cancer or not. But what we do know is that the e-cigarettes, what gets aerosolized, it does contain harmful substances, and that can cause damage to your DNA. And in mouse lungs, so in mice, they actually have been shown to cause cancer. So it's not a stretch to say that e-cigarettes also may put you at risk for lung cancer, and we just may not have enough evidence about it yet. Asbestos is one of the ones that people know from the past historically, and it's because it is associated with a higher risk of lung cancer. And those who have been exposed to asbestos, the risk of cancer can be almost 5 times as high as someone that's not exposed. And the level of exposure and the type of asbestos that you're exposed to with affects your risk of cancer. So for those exposed to the amphiboly fibers are less than the chrysolyte fibers. And the most important thing to know here is that often if you're exposed to both asbestos and lung cancer, that's not just additive. Like, it's not just like your risk of cancer from smoking and your risk of lung cancer from asbestos equals your overall risk. It's actually it's multiplied, so it's synergistic. And so we definitely want to watch out for that in people who are exposed to asbestos who may be smoking. Massachusetts has a strong asbestos safety program. So I put the link up there if you go to mass.gov. And it basically has information and all. I put this as for schools and in particular. So most schools have been checked, and the ones in green means no asbestos. The one in yes means asbestos were found at some point, and they're taking steps to fix it. The ones that have no data tend to be newer schools, but places that may not have reported their asbestos yet. It's just a good resource to look, especially if you're concerned about school-age children and the place that they're going to school. Hey, when was the last time that this school was inspected for asbestos? What was the status at that time? And through that website, you can find it, and you can always request the state to do a safety report if they haven't done one in a while. And there are certain occupations that are associated with asbestos. We typically think of plumbers, electricians, and people who install installation, anyone who works in boiler rooms, Navy and shipbuilding. Those are all industries that in the past have been associated with asbestos, and definitely something to talk about with your doctor if you were in one of those occupations and if you were potentially exposed to asbestos. Radon is, I feel, one that doesn't get talked about enough, but should get talked about more. So what radon is a gas, and it has been associated with an increase of lung cancer. It's basically it's the byproduct of decay of uranium and radium from the soil and the bedrock. And so it can get into the house through lots of different mechanisms. If you have cracks in the foundation, through windows, through the shower, through the groundwater, and then it's present everywhere. So it's not anything you can do to treat the underlying source of radon, but there is something that you can do to get rid of radon in the house. And I will say that radon is the second leading cause of, it's thought to be the second leading cause of lung cancer after tobacco smoking, actually, just because it's so common. And the risk increases with higher radon concentration. So particularly above 100. So before you buy any house in the state of Massachusetts, it's required that you're given a radon report. And most houses in Massachusetts are, around 5 or 5. It depends on how old the house is, but 5 to 10. So we're talking about levels of 100 being the ones most concerning. And you should definitely check to make sure your level is not that high, because it is something that can be easily fixed with a radon mitigation system. So essentially, it's a fan that gets installed towards the foundation of the house with a vent that goes all the way to the outside to get rid of the radon into the environment. Smoke from cooking and heating. This is not as much of a common problem in the US. It's more concerning in developing countries. And it really it can increase your risk of getting COPD as well as lung cancer. And for people who use this as their primary source of cooking, it's estimated that their lifetime risk of lung cancer may be as high as 20%. So not that far off from smoking. And it is definitely a concern worldwide, which is, one of the reasons why lung cancer in the world is still very much a leading cause of death. But in the US, using wood or coal to heat up your food is not that common. But something to think about if you know someone that has that kind of setup at home, or if they're burning a lot of wood without a chimney in the house. And then another cause that I think is really relevant and more evidence is coming out is air pollution and diesel exhaust. So we have what we call particulate matter in the air. So there's particulate matter that's less than 2.5 micrometers, so very small. You wouldn't be able to see it. There is one and those are things like that may happen from things like wood burning or wildfires or even construction. Then there's the larger ones that are, between 2 and 10 micrometers. So those are things like dust and smoke. Sometimes you can, if there's a lot of it in that area, you can see it in vehicle exhaust and pollen to some degree. And the comparison in size as human hair is 50 to 70. So it's barely perceptible, but it's there. And every day, if you go on your phone or if you go online, it will tell you the current air quality in where you live. So I looked it up for Springfield today, and it was saying today the air quality index was poor. The score was 53, and it tells you what makes that up. And so it tells you that it's mostly due to nitrogen dioxide, which is a marker for air pollution from cars and other uh, traffic related air pollution. But the fine particulate matter, the rest of it was actually not bad, and the large particulate matter wasn't bad. Uh, so it's mostly there's some pollution in the air today. And I looked at it yesterday and it was good. So I think it was just a one-off thing, maybe from the changes in temperature. I won't go too much uh, through some of the other less common causes, but depending on what people do for a living, may have been exposed to things that could potentially be related to lung cancer, and so there's a list of those. But I will highlight that the contribution of lung cancer from all these things is relatively small compared to the effects of cigarette smoking. So cigarette smoking is definitely the largest contributor to a risk of lung cancer. And question always comes up about family history, and we don't know well how much it plays a role, but there is evidence to suggest that there are certain genes that may predispose you to lung cancer. And that's particularly true if you come from a family where someone was diagnosed with lung cancer at a younger age, without much of a smoking history, and those with multiple affected family members. Often those are families that may have cancers in other parts of their body, not just their lung. So it's definitely more work is needed to be done, but it's definitely something that is possible. And diet also comes up frequently. And I think there's been some studies that maybe suggest that eating more fruits and vegetables decreases your risk of lung cancer, but that hasn't been proved in any high evidence and quality studies. So it's not as strong as with some of the other cancers, particularly colon cancer. So I would just say, I think in general, a healthy diet is better for your overall health. Can't say for sure that it's directly related to lung cancer. And then lastly, what can we do about it? So I don't want to be all doom and gloom about, saying the word lung cancer over and over again. And these are all the things that are associated with it. I do want to say that there's some good news, that there is a lung screening exam that saves lives. And that exam is a yearly low dose CT. So a CAT scan machine is this donut hole, and you go in for about 15 seconds just to the chest. Your head never goes in. So your head is not locked in one place. And they take a picture over 15, 30 seconds, and then you come out. The whole thing takes about a minute. And it's a yearly exam, similar to how women get mammography. And most people that are eligible for it actually don't get it. And this is an old slide from the CDC. So the people who can definitely get it, and it's covered by your insurance, is adults between the ages of 50 and 80 who have smoked for approximately 20 years and are either currently smoking or have quit in the past 15 years. And there are some exceptions to that, but that's the general rule of thumb. And this is the study that showed in the US that lung cancer screening saves lives. So low dose CT, a CAT scan, compared to chest x-ray. So for decades, they have been doing chest x-rays, which is that quick film that you do in the doctor's office usually like on the first floor, with radiology as for a long time, they thought that was the way that we were going to beat lung cancer. But they found out that chest x-rays are actually not any better than doing nothing, because the precancerous lesions start so small that you really do need a CAT scan to see it. And so with a yearly low dose CT, more cancers were detected, and importantly, the deaths from lung cancer decreased. And just a timeline of when this all happened. So this study came out in 2011. In 2013, U.S. Preventative Service Task Force, which is the regulatory body that recommends preventive exams for the U.S., so they reviewed all the evidence for it, and they gave it a grade B, which is the same as mammography and colon cancer and cervical cancer screening. And it was for those age groups, 55 to 80, who have at this time it was 30-pack year smoking history and have quit within the last 15 years. And then in 2015, Medicare had a decision memo that they covered lung cancer screening. And under the Affordable Care Act, if Medicare covers lung screening, all private insurers have to cover lung cancer screening. So the answer is it's covered. It's covered by your insurance company. Sometimes in Massachusetts, we're pretty lucky. It's pretty hassle-free. There's no copay or prior authorization required. That varies state by state. And you may sometimes get some insurance companies trying to push back on it, but generally we can get people lung screening pretty easily. And then in 2021, after they reviewed the evidence further, they made it so that more people are eligible for screening. So if you have if you're between the ages of 50 and 80 with a 20-pack year smoking history and you quit within the past 15 years. And this term pack year means that so 20 pack years, if you smoked a pack per day for 20 years, that would be 20 pack years. If you smoked half a pack per day for 40 years, that would also be 20 pack years. Or if you smoke 2 packs per day for 10 years, that would be 20 pack years. So it's all about the dose of smoking. And we know lung screening is the most effective cancer screening exam we have. So this is what we call a number needed to screen. So how many individuals do we need to screen to save a life from one cancer? And so in lung cancer, we need to screen 320 individuals. Mammography, we need to screen about 380 individuals. Colonoscopy is 870 individuals we have to do a colonoscopy on to save a life from colon cancer. And prostate cancer, PSA, which is a little controversial because it has so many false positives. It's about 1,400. And even though it's the most effective cancer screening exam, it's actually doing really poorly. So this show the rates of cervical and breast cancer screening, about 70 to 80% are up to date with their screening exam. Colorectal, because of colonoscopy or having to do with stool, it's traditionally been lower. But if you squint your eyes down here, you can see lung screening is 5 to 10%. And if you draw it out to 2024, it's actually stayed below the 10%. It hasn't increased much. So even though some people may argue it's because the test is relatively new, but the slope of lung screening is still the slope is not high. So it's still a very low slope, especially compared to the other cancer screening exams. And we talked about the groups that qualify for screening if you're between those ages, if you have that smoking history, but you can also calculate your risk of lung cancer based on other factors. So your smoking, your age, I don't have all the fields here, but your family history, your occupation. And so if your risk of cancer is high enough, you would qualify for it based on your overall predicted risk. So that's also another way we can get people screening. Right now, lung screening with a low-dose CT is the only proven method we have to pick up lung cancer early. There's new research being done and new work being done on, can we do a test of your breath, or can we do blood work and look at some markers? That's still in the preliminary stages. So far, it's only been useful in people who already have found to have a nodule, and we're trying to figure out the risk of that nodule being cancerous or not. But for people who feel completely normal and want to know if they have the risk of lung cancer, you either qualify if you have that smoking history and that age between 50 and 80, or if your risk of cancer is greater than it's 1.5 over the calculator here. And yeah, I think I want to say the take home points for this talk is just really highlighting the importance of lung cancer, how deadly it is. It doesn't get talked about enough. It's often been stigmatized because of smoking. So, tobacco companies, they pointed the fingers at people who smoke. They said they don't have willpower if they can't quit smoking, and it's their fault if they get lung cancer, when that's really not true. That was just tobacco companies trying to get the blame off themselves. They put nicotine, which is one of the most addictive substances out there. They marketed it, they gave it for free. They took advantage of people who are in vulnerable situations. For example, if you're in the military, when you're away from your family and you're young and you're more impressionable, that's when you're most likely to be exposed to tobacco. And then the prices for tobacco went up and they became really rich. It's something that I, you know, I don't know that today would be legal, and I think many places are trying to institute bans for if you were born after, and this is in the UK and Massachusetts, if you were born after, let's say 1988 or 1990, then you can never buy cigarettes because by then we knew enough, and you shouldn't have, picked up smoking. Uh, and there are several risk factors. So aside from tobacco, we talked about radon, asbestos, particulate matter from pollution, and some other environmental and occupational exposures. And screening with yearly low dose CT saves lives, but we do need to use it more. So that's part of the motivation for this talk is if anyone thinks that they would qualify, we're happy to do the risk calculator for you and see if we can get you screened that way. All right, so I will stop sharing my screen and see what questions people have.
Thank you, Dr. Nunez. That was really terrific. And I loved how you covered all of those possible scenarios and situations for lung cancer. Really interesting. There are a number of questions in the queue, and we invite the audience to type their questions into the Q&A box for Dr. Nunez. The first question is wearing a mask an effective way to deal with air pollution? And if so, is there a particular type of mask recommended?
Yeah, so I think there's still more work that needs to be done on figuring out when to wear a mask outside and when not to wear a mask and what kind of mask. But generally, I would say, especially if someone that has a lung problem, so they have COPD or asthma, and the air quality is bad outside, I would recommend wearing a mask, and I would recommend wearing a like KN95 or an N95, just if you're going to wear a mask, get the most benefit out of it. Um, but I think in terms of how it relates to lung cancer, that's definitely a little bit less clear and something that we need to do more work about so that we can provide appropriate guidance.
Very good. Thank you. The next question, does 30 pack year mean 30 packs per year or something else?
Yeah, and thank you for bringing that question up because that question comes up every time that the word pack year comes up, and I did give an example of it after I realized that I hadn't explained it. So a pack year means that you smoked a pack per day for 1 year, and so if 30, you can get to 30 pack years by smoking 1 pack per day for 30 years. You can also get to it by smoking 2 packs per day for 15 years. So there's different ways to get to that pack year calculation.
Very good. In your experience, what are the most effective cessation approaches?
Yeah, another great question, and something I thought about including in this talk, and I left tobacco treatment completely out of it. But the best our medications and treatment for tobacco have gotten much better over the last 10, 20 years. So uh, we recommend nicotine replacement therapy combined with an oral medication like Chantix. So Chantix plus the patch. And then if you have breakthrough cravings, you can use the nicotine gum or lozenge. So using both of those together really gets you more bang for your buck. And the other thing is, there used to be a warning that nicotine patches, don't smoke while you're on the nicotine patch. And that's actually, we we were wrong about that. So that was more just like a cover yourself situation where they just didn't want the nicotine patch makers being sued. But really, if if you smoke and you're on the patch at the same time, it's like having a bad day and smoking more cigarettes. So yes, there may be a you may be getting more nicotine and any, that could potentially have a side effect, but your risk of having a health related complication from smoking is so much higher that it outweighs any risk of using the patch and smoking at the same time. So we tell people it's more important to form the habit, use the patch every day, put it on the morning, take it off at night, and form that habit for 4 weeks. And then, you can either pick a quit date, uh, you can just start cutting back cigarettes as your body's no longer dependent on nicotine.
That is great information. Thank you. The next question, curious why you think the number of screenings for lung cancer is lagging so far behind other screenings.
Yeah, and such a great question that I could spend hours talking about. The One of the key reasons is most people don't know about it. So about 75% of people who are eligible for a screening exam have never heard of it. And so it's hard to get something that they've never heard about. And then on top of that, doctor's visits, they only give your doctor 20 minutes to spend with you. And they have this whole list of things that are, important and things that they've been asked to do, as part of their health maintenance. And so something that is new and it's dependent on a provider who doesn't have a lot of time already in that visit. Uh, and providers often are unsure themselves of a lot of the details of lung screening. So those are several reasons for it. There's also stigma associated with smoking. Uh, so people may just not be bringing up smoking to their doctors, and then they may be afraid of the word lung cancer. And if they hear about this lung screening test, they may be too afraid to go get it. Uh, and then things with insurance and, what's the cost, any barriers that get put in the way. And then it's just um, made it challenging to make a dent in that. And but we're really working. We're really trying to change that so it's not as huge of a difference as compared to uh, other cancer screening exams.
And I think you just answered the next question, which was why is lung screening not a standard screening like mammography?
It is a standard screening in a sense. I think in the way U.S. Preventative Service Task Force does it, it is actually. But one of the issues that it's not, it's putting it hasn't been tied into dollars. So there's this quality metrics that we use nationwide, and you can measure, a clinic's performance, a region's performance, a doctor's performance based on what percentage of their patients have breast cancer screening. And if you see that number is low or high, like if it's low, people can get penalized. It's like, oh, you aren't getting your people screened or their A1C under control. And then that, they may get reimbursed less. It's usually financial incentives to get people more uh, better hit their marks, hit their targets. But lung cancer screening hasn't been one of, and those are called the HEDIS measurements. Lung cancer screening has not been a HEDIS measurement, and that is in the progress and works to change that. I think they're rolling it out. They're pilot testing in 2025 with potential, and it looks like it's working that they can measure this data with potentially testing, rolling it out 2026 as a HEDIS measurement.
Excellent. Well done. The next question, are there any other health issues linked to lung cancer?
The so lung cancer, I one of my mission is to when people hear the word lung cancer, they don't think it's a death sentence. Treatments have changed, have gotten much better. If we catch it early, it's just like having any other treatable condition. You can live the same quality and the same quantity of life if you treat it early and you get it where it's surgically, you can just take it out with surgery. There's no other, like, I think there's depression and anxiety, mental health related disorders. Uh, Lung cancer in advanced stages would certainly be linked to cardiovascular health. But in the early stages, if you catch it and treat it early, it shouldn't have any other health issues with it.
Oh, that's great news. We have this isn't a question, this is just sharing some information. An experience. This person wanted to share that their dear friend who quit 20 years ago was encouraged by her doctor to get a screening. And her doctor shared that for this person it was only $35 and that it was totally worth it because it saved her life. Oh,
Yeah,
success
that's
story
wonderful.
there.
Wonderful to hear. Um, and it's so great when we catch someone early and save their life. I'm sorry that they had to pay $35 for it. It should, we want it to be free for everyone.
Yeah.
But it's, thank you for sharing, and that's such a wonderful story, and that's what we hope to see over and over again with people, and you know, not seeing them in the hospital when it's late stage, and unfortunately, not much that can be done.
It looks like, well, thank you, doctor. Looks like that's the end of our questions and the end of our event today, but I want to thank you for sharing your time and expertise and our audience for these great questions and being part of tonight's terrific presentation. So thank you.
Yeah, thank you so much, and thank you for having me. And very nice to talk to everyone.